Hello, thank you all for being here tonight. I'm Kavi, I use they, them pronouns, and I'm a current health educator in Boston.
And I'm Brandon Nguyen, and I use he, him, his pronouns, and I'm a current 12th grader at Vaughn International Studies Academy in Pacoima, California. When I was in ninth grade, I received Peer Health Exchange, and now I'm a Youth Advisory Board member.
We're excited to share a little more with each other and you all at home about why we PHE and what it's like. To kick us off, Brandon, what is the Youth Advisory Board like, and why did you want to join it?
So the Youth Advisory Board is just made up of a bunch of youth who have received peer health exchange programming in the past or currently, and they all come together and we all discuss about how PHE has impacted us and how it has helped us, as well as ways that PHE can help improve the program, as well as help be more relevant and impactful to our students, and so that we are as helpful as possible. And I wanted to join it because I really wanted a seat at the table because being having a seat at the table and having youth voice is something that's really important in a lot of organizations, especially in peer health exchange where it is for the youth. And I think that the biggest thing is having youth voice, being the people that tell the programs in our organization and what we think is relevant to us and what is impactful and what is helpful to us, so that we get the best programming and get the most impactful experience.
Speaking of being a near peer, I was wondering, Brandon, considering you also spoke about how it was nice to have people close in age to you in the classroom, how did it feel learning about mental health and sexual health topics from a health educator instead of just from your teacher?
Yeah, so like what you mentioned about the near peers and being able to make those raw connections with those fun icebreakers or just getting to know about people's day, I think that it really helps build that connection that you don't really get with your teachers because they tend to be older adults and they tend to be a lot more intimidating because they are your teachers. These are the people that are giving you your grade and that you see on a daily basis. But these health educators are really just relatable people and students and youth that are fellow youth that actually come and are they change things and they mix things up for you and they make things fun. And I think that having them teach you health education has really opened up so many possibilities where students feel that they're more confident and that they're more comfortable with asking questions and that they're actually being able to be heard by other people, that their experiences are validated by other people that are close in age, and that's often older adults tend to not do that, where they often tell them like, oh, like this isn't what it was like when I was a teenager, or invalidating their experiences. So I think with these health educators, they've been such an amazing resource for a lot of the youth now.
So now that you're a senior, what would you tell your ninth grade self and ninth grade peers about health education?
Really, I would emphasize how important it would be. A lot of the times it would be, oh, like this is just stuff you could search up online, or ew, why are we talking about this? And that's the common belief amongst ninth graders now, and they don't realize how important of a topic it is, whether it be about consent and substance abuse, or it be about sexual health. I think those are all important topics that just get looked over so often, and it's often in a lot of cultures is very taboo or not discussed often. So I think that I would tell a lot of my ninth grade self and ninth grade peers to be a lot more open minded, to tell themselves to like ask questions, be curious, to be participating in these programs, and to really take away things that you'll learn and take away things that will be important in your life and you never know, you may use down the line. So I would totally suggest that to my ninth grade self and to my ninth grade peers. So since you spend a lot of the time participating with students and really teaching students, is there a moment with a student or that has really stuck with you, and why?
Yeah, I mean, I have some favorite students for sure, but I love when folks ask questions, and I think my favorite moments have been when I open myself up to students and they open themselves back up to me. I think one of my favorite moments was when I was leading one of the earlier workshops, the identity and health workshop. I talk with a fair amount of students who are trans, non-binary, LGBT, etc. And I think we've had some really fantastic conversations within that workshop. As you can see, I have a giant trans flag behind me, and I'm really open about my identities in the classroom. So I think that folks hopefully feel a little more comfortable having these conversations with me rather than a teacher. And folks have asked some really awesome questions. People correcting each other on pronoun use, asking questions about history, the biology of sex, just stuff that really doesn't often get answered fully, if at all, in a classroom or academic environment. So I think all those conversations during that workshop, and also how that's extended into conversations about mental health and sexual health. It's really stuck with me because I felt really honored, and I continue to feel really honored to be in that space with students as inquirers, and in a space with so many young people who often understand themselves better than I think a lot of my peers did at their age. So it's been really awesome in so many regards. So speaking of, have you made decisions in your life that were influenced by your time working with Peer Health Exchange, either as a ninth grader or now?
Definitely, peer health exchange has definitely really impacted my life. I think starting in ninth grade, the biggest thing was just mental health. I really didn't really take care of myself often. I'd be like, oh, like I'm fine, like I'll just like help out, or used to really like spread myself really really thin, and it would be really really hard for me to take care of myself. So what peer health exchange really taught me was just how to have boundaries, but also to have time for myself, to really take care of myself, to not stress out so much, and that there's so many stress coping mechanisms that I can develop that are a lot healthier than what I had in the past, or I didn't even have any in the past. So ninth grade has really helped me make the decision of putting myself first and just being able to take care of myself, especially when I didn't feel well. And I think that now the biggest thing, the decision in my life that Peer Health Exchange has helped me is that it really helped me decide to become really a leader and to use my voice and not be so afraid of advocating for health equity, as in I get to use my voice to speak to other students or speak on panels to really talk about health equity, especially from a youth lens. And I think that is really, really important that we have a lot more students to do that, and that a lot of students do decide to become leaders, do decide to use their voice a lot more often, because it can be very daunting at first. And also, Peer Health Exchange has also impacted my major choice when I go off to college as I'm a senior. So I used to be a hard sciences person. I used to love biology, chemistry, chem physics, but then I realized how important health education is, and how important like the psychology, sociology of it is, and public policy, and all the important aspects of it, that it really inspired me to really want to work with other people about health equity, and it has really inspired me to go off into college and do something related in that field. So it has really impacted my life in so many ways. So speaking of how you were impacted by Peer Health Exchange, what would you say to someone who asks you if they should become a PHE health educator?
Yeah, I mean, first, I just want to, that was an amazing answer, and you're making me really jealous that I didn't have any of Peer Health Exchange health education in high school. Definitely spread myself too thin. I hear a lot of my past self in your answer. So that's first. That's really awesome to hear, and also the major thing. You were just a couple of years ahead of me on that one. But yeah, no, I would really encourage people to do it if they like talking to teenagers and are okay with having awkward conversations. I think you have to bring the spirit of like being okay with awkwardness into the classroom in order to really get the most out of this and give the students the most that they can get out of it. It can sometimes be difficult to talk about sex and substance use and mental health and be both, honest and informative. But it's really rewarding, I think, for myself. I've learned a lot about myself and about how to be there for people and how to be the best support that I can be. I wouldn't pass that up if I went back at all. And I'm not just saying this because they picked me to do this interview. I really do mean it. I think the near peer model is really close to my heart, and it's been great to be, on the front lines of health equity instead of just like being in a classroom learning about health and learning about, statistics and prevention and harm reduction. So there's something so powerful about going into classrooms and speaking with young people directly and kind of getting to do some of that frontline work. And I don't know, it's so 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 important. So if any of that makes someone excited, I think that they should do it, especially because the near peer model is, I think, one of the best ways of communicating information that I've seen. Speaking of, adults want to help so much, but they're often so bad at it. What do you wish that teachers, parents, and adults knew?
So definitely, I think the biggest thing is just to listen. I think that that's one thing that a lot of adults, when listening to youth, have struggled with very often, with our own parents, with other adults and organizations, or just adults in general, is that they base a lot of things off of their own experiences. Well, I hate to break it to you, but a lot of the times, what teenagers and youth are experiencing now is different from what youth is experiencing when you were a youth. So I would say that really just open your ears, listen, be empathetic, and also just not base everything off of your experiences. Not your advice may not always apply to every youth out there, but just listen and really take what they say and really take it to heart and really work with them and find ways that you can make solutions to find resources. And I think that's what Health Exchange has been doing really great lately with the Youth Advisory Board, where we feel listened to, where we work with so many staff members that come and they come talk to us, they ask us questions, they give us surveys, they have us participate and lead so many projects that it's been an excellent way of having adults listen, feeling that comfortable that adults are listening to us and that they're actually uh, listening to what we say and not invalidating our experiences. So, just for all the teachers, parents, and adults out there, really just listen to us. We know that it can sometimes come off as we're complaining a lot, or that we're just being teenagers or something. But no, we actually have these feelings. We actually have these beliefs and thoughts that are really, really important to us and really dear to our heart. And we're actually experiencing these things. So if you could just open your ears and be open minded and just listen, I think that is the biggest advice I would give.
Thank you so much, everyone, for being here and for giving us your time tonight.
Thank you, everyone, again for allowing us to share our stories and perspectives.
And now we're going to pass it over to Dr. Iko, the Director of Program Design and Development.